to the Natural Doctors, and I'm Dr. Jennifer Stagg.
And I'm Dr. Katie Dinello. We're so glad you're joining us. So we are in episode 3 of a 3-part series all about herbs and herbal medicine and how we use herbs to treat a lot of conditions. So if you haven't checked out our last 2 episodes, make sure you watch those first and then come back for this one. But in this episode today, we are going to talk all about using herbs for common ailments that we all have, right? So we're going to try and give you some more practical advice about what these herbs are used for, how we can use them. Now, remember, it's always a great idea to work with a naturopathic or a holistic provider, an herbalist, on how to use these specifically for you. But again, remember, this is our land's own medicine, right? Mm-hmm. So this is available to everybody. That's why we originally started this series, is because we have so many more patients coming to us asking for alternatives to medications. And so this is what we talk about all day long with our patients. So a good place to start is digestion, right? So all of the different ailments that we can have related to our digestion, which is a lot. So I'm sure everybody watching this has some sort of digestion issue going on here, super common. And so let's start to talk about some herbs. So I think a good place to start here is to just tell you a little bit about some of the actions that these herbs can have on our gut. So cholagogues and choleretics, those are fancy words here, but in herbal medicine, those are things that stimulate and help produce bile. So whether it's working on the liver to help make bile, or it's stimulating the gallbladder to help release bile, we have a lot of bitter herbs that do this. And that's really the first step that we can use herbs into improving our digestion. Are you using a lot of bitters in your clinic?
Absolutely. So, I mean, when it comes to bile flow and the gallbladder, a lot of people are kind of like, oh, what are you talking about, right? Cholagals, choleretics. I mean, we're not always pulling out those words when we're talking with patients, but a lot of times, you know, a patient will come in, they're having multiple different things will sort of get me interested in bile acid secretion, you know, these compounds that come out of the gallbladder that I think, oh, there could be an issue here, right? Because most people they only know about gallbladder attacks or stones, right? And so they're not necessarily coming in prompting like, oh, I think I need something for my gallbladder. So symptoms that people would present with that might make you, you know, concerned there's something going on with their gallbladder would be fat maldigestion, first of all. So if someone is having issues when they're eating, you know, a bigger meal that has more fat in it, they might have, you know, urgency. They got to go to the bathroom really quickly. They have maybe fatty stools, diarrhea. That could be an issue with bile acids. Another thing that I'm seeing a lot of is patients that have SIBO. Now, herbs work really well here. So that's the overgrowth of bacteria in the small intestine. But we as naturopathic doctors are always looking at, well, why is that happening, right? And one of the big things that's coming out right now, so a lot of you who are very functionally medicine minded, and maybe some of you are dealing with SIBO, really look at bile acids, because that is like the secretions that are coming out, these digestive secretions can be a big issue as to why, you know, that SIBO is not clearing fully or keeps coming back. So some of the herbs that we like to use there would be, you know, things like artichoke, dandelion, we talked about that. Like that's really nice for as a stimulant. Gentian, we talked about bitters. Gentian is one of the most potent bitters out there, and it really does have really nice effects on the gallbladder as well.
It does. And these herbs, we call them bitters because they taste very, very bitter. So another really cool key here is we want to taste that bitter flavor in our mouth. And so, you know, a lot of herbalists will say, chew on gentian root, right? That's not what we're doing, because a lot of our patients would run in the other direction and they would never come back because it is such a strong flavor. But there are different herbal compounds that we can use now in a tablet form, and you kind of just let them like soak in your mouth so you get that bitter flavor. And we like to take these prior to a meal so that we can really start to get those digestive secretions, that bile, those pancreatic enzymes flowing in preparation for a meal. So when you eat, everything's ready to go to digest that food. And I want to go back to, how you said so many people only think about their gallbladder when they get a gallbladder attack, right? It's that pain and that upper kind of right portion of your abdomen there. And so you go into the ER, you go to your doctor and they say, oh gosh, yeah, like you probably need your gallbladder out. And I just feel so passionately that we can intervene before we have to get to that point of having a whole organ removed. And so if you're having any symptoms where, you almost feel like food is kind of sitting in your stomach, right? Like you eat a meal and you're like, oh, I just feel so full. That doesn't feel good. I only had a couple of bites. Or you're dealing with constipation is another key issue there.
Yep.
That is a really nice time to bring in these digestive bitters. So like you said, gentian root, artichoke, chamomile. Chamomile is actually a beautiful digestive bitter, right?
Yep.
And so we can take that either as tea or a tincture form prior to a meal. So that's a really good example.
Yeah, while we're on that gallbladder topic, I think another indication for women out there is estrogen dominance. Like when people have a lot of estrogen, they can have issues with their gallbladder. So this is something to really think about. And we see this postpartum.
We do.
Seen that, and it is, that can happen where women all of a sudden start having problems with their gallbladder. They're 5-6 weeks postpartum. And this has to do with the actual bile flow. So too much estrogen can impact how the bile gets, passed through the liver and through the gallbladder. And this is where herbal medicine would be important. Now, obviously, in that circumstance, if you have like a nursing mother, then you really want to work with a very knowledgeable doctor who understands herbal medicine, or, a traditional herbalist, registered herbalist, to make sure the herbs that you're using would be safe to use during breastfeeding.
Exactly.
But this also happens in perimenopause too. So this is why the rates of having your gallbladder removed are pretty high in the 40s age group, 40s to 50 age group. And it has to do with surging levels of estrogen dominance. Because in perimenopause, you're having highs and lows. And this is where we definitely think about digestion here and bile flow. And I feel like I don't hear a lot about this out there. So I'm glad we're talking about it.
I am too. Yeah, exactly. Right. Because the liver is what makes our bile, right? And we need a healthy liver in order to deal with this hormone excess that we can have. And, we use this term estrogen dominance, right? It doesn't, yes, we could be producing higher levels of estrogen, but it could just be, we've got normal levels of estrogen, but again, our liver is not doing what it's supposed to be doing. It's stagnant, it's sluggish, right? And that's because of environmental toxins, stress. And so using some of these herbs, fennel is another great one, chamomile. We could even use dim, which is not necessarily an herb per se, but it's a compound in vegetables that we eat, really to focus on and improve that liver health. But again, it is that synergy between the liver and the gallbladder, and making sure our bile is healthy, and then making sure the flow of that bile is healthy.
Yeah,
so,
that's fantastic. So I think we did a really good job, talking about digestive secretions and herbs that can be used to help with bile flow and improve, digestive function, with hydrochloric acid being adequate, and then also having enough of the enzymes kind of coming into play. The other big issue digestive-wise, and there are a lot, but another big issue in terms of just the function of the digestive tract is motility.
Yes.
So this is another wonderful place to use herbal medicine. It really shines in this situation, but a lot of patients are dealing with slow motility, some fast, but a lot of patients, and again, especially the women that are perimenopausal, menopausal, a common complaint is constipation, and that can really come down to how, the bowel, the nervous system in the bowel is functioning, right?
Yes.
So we have this class of compounds, many of them plants, that act as what we call prokinetics, right? So there are a number of plants that do that. Do we want to talk about that a little bit?
Let's do it.
Okay.
Yeah. The one that I use the most is artichoke, actually. This is a great herbal prokinetic. Now, prokinetics, we have drugs that do this as well. They're intense drugs, come with a lot of side effects, and you have to be on them for a long time. So rather than that, we can use these herbs like artichoke is a really good one. We can also, again, not an herb, but 5-HTP is another great herbal prokinetic because 5-HTP works on the nervous system of our gut so that we can really regulate that. So those are two that I use.
Another, I use both of those as well. Another beautiful one is ginger. And ginger is a really good prokinetic. It also, it has a lot of, broad system effects. It's anti-inflammatory as well, but it's something that you can use as a tea even, right? So you can steep that when I'm thinking about using herbal teas, because sometimes people, if we're using a lot of different supplements for various different functional issues that we're trying to manage, we might want to try a tea as another way to get that plant medicine in the patient. But whenever I'm using ginger tea, and there's certainly capsule versions of that if you don't like the taste of ginger, I will have patients do like double bag it, right? So you need to be using enough of a tea and, doing it frequently. So you probably need to do that 3 times a day in order to really get the benefits of ginger. Another thing I do is I'll have them sort of like put a little saucer or cover over their cup while they're steeping the ginger to keep those volatile compounds kind of concentrated in the tea.
Yes.
And if they don't like hot tea, they can do cold, right? So that you can steep it. You wouldn't want to do a cold steep on ginger, but you could steep it in sort of concentrated and let it sit long enough, 8-10 minutes, and then you could pour that over ice.
Yes. Yeah, absolutely.
And that'll work too.
Yeah, it's beautiful. And ginger is such a beautiful herb because it's also anti-inflammatory. And so we're getting that whole piece too. It can kind of stimulate blood flow as well. So if we're dealing with cardiovascular issues, that might be something we want to add on. So again, just a reminder that, we talk about herbs in kind of these single uses of like, oh, we use this herb for this one thing, but that's not truly the case. Like we know as doctors who have studied herbs, like they have many, many mechanisms of action. And again, that's just such a beautiful reminder of why we love herbs so much.
Yeah, that's wonderful.
Anything else gut related? Do you want to move on to something else? Or, we can keep talking about that.
Right, I know. We could do like a whole episode or series of episodes on herbs for digestive health, but maybe we just kind of just touch a little bit on antibacterial herbs. I did bring up SIBO, which is a big issue that I'm having a lot of patients that are dealing with. So that bacterial overgrowth in the gut, you can treat that with herbal medicine. So herbs have, again, like they have multi-actions, but many of them are antimicrobial or antibacterial, but also antifungal. So a lot of times when we're dealing with patients that have bacterial overgrowth, many of them can have also some fungal overgrowth layered on top of that. So they can have SIBO and SIFO. And then if you were using pharmaceuticals, you'd have to take an antibiotic, maybe 2 antibiotics if you have like a double SIBO, like a methane and hydrogen, and then take an antifungal on top of that. Again, all coming with increased risk of side effects, right? You start combining now like 3 different antimicrobial medicines.
That's tough on the liver, those antifungal medications.
It is. And then it leaves them susceptible to even more issues, right? Because they are just like, can be really harsh on the digestive system, but you can use herbal medicine here, right? So, and it's going to have dual action. So it's not only going to be antibacterial, it can cover the fungal component as well. So
exactly.
There's beautiful blends, a lot of them, thyme, oregano. There's wonderful options that you can use in herbal medicine.
Yeah, we can use garlic, we can use berberine. Berberine is a hot topic right now. Berberine has a lot of different uses in the body. Right now, it's very popular because it can really help stimulate your own production of GLP-1.
Well, that's a good segue.
Right.
We could just So that is a good topic, though. We could talk about cardiovascular, cardiometabolic uses. So really focus on that.
Yeah.
But, so
exactly.
let's talk about berberine and GL. Again, that might be a series.
This is a GLP one. Yeah, exactly. But yeah, so berberine, it can help, like we mentioned in our previous episodes, it can help with sugar regulations, right, and insulin resistance in that piece. But from a digestive standpoint, berberine is a great antibacterial for our gut. And so it's a very common herb in different blends that we use for SIBO that we've been talking about here. Berberine on its own too, whether it's in a blender on its own, is great for digestive health because of this other word that we use called dysbiosis, which SIBO is a type of dysbiosis, but even if you don't have SIBO, you might have an overgrowth of another pathogenic or bad bacteria in your gut, and that's where berberine can be used too. But yes, there are so many antibacterial, antifungal herbs that we can use to help treat digestive issues. So then berberine, we actually find it in a lot of cardiovascular tonics and blends to help with cholesterol, and it works very, very well. There is fabulous data on berberine for lowering your LDL or your bad cholesterol. So we find it in a lot of blends that we use for cardiovascular health too.
Yep. Yeah. So berberine comes from, a plant. It is a compound found in in multiple different herbs. So Oregon grape, golden seal, very rich sources of berberine. And so it has antimicrobial benefits. It has the cholesterol benefits you talked about. We talked slightly GLP-1 effects, right? So it actually can lower blood sugar. It's actually a really good, it's been the subject of many studies to metformin. So a completely compared milligram per milligram. I think there's something like 40 studies or something on this.
There's a lot.
Milligram per milligram, it works just as well as metformin without as much risk of side effects. Now, sometimes I will have patients that when we're using like a lot higher doses of berberine, if we're really trying to get, a boost in metabolism and really address the insulin and affect food cravings, we might use much higher doses of berberine. And I have run into some cases where people are having, when I say digestive side effects, I mean like they're having fecal urgency, some diarrhea, loose stools, and then we kind of scale them back. But yeah, it's a really great herbal medicine to use in that set of circumstances. And then the other thing that we often see in these patients that have gut dysbiosis, they are insulin resistant, their cholesterol is elevated, is they can have fatty liver. And so here is another great example of using a plant that we're going to have all these widespread benefits. So we're not having to use like X medicine here, Y medicine there, for all these separate conditions. Berberine is going to cover that whole sort of cardiometabolic profile. So you're going to get a lot of bang for your buck.
Exactly. Right? I have to take a minute here to just, if you have not been tested for fatty liver, please, just get yourself checked out by your provider, because I don't know about you, I am fighting fatty liver all the time. It's a very, very simple blood test that we can use as a first line basis to see if you have fatty liver. And then if we need to, we can get an ultrasound. But it is such a problem in a lot of the patients that I see. It does go hand in hand with insulin resistance, cardiovascular disease, like we said. So my little soapbox there.
Important. It is important.
Yes.
With our remaining time, maybe we could talk a little bit more about cardiovascular health. So so maybe garlic.
Yeah.
Let's talk about garlic.
Let's start with garlic. Exactly. Garlic. So gosh, yes, we're talking about the garlic that you find in your kitchen, right? It's a delicious, delicious herb that we use. It's funny because yes, we use garlic for cardiovascular health, but we use it for so much more. So I'll talk a little bit about it here. So we use it actually as antibacterial and antiviral. So I use this in my house for myself when I start to feel a cold coming on. I go immediately for raw garlic. I really do. I'm not lying here, you guys. So I take fresh raw garlic. I crush it up a little bit. I put some honey over it, and then I eat it. You want to do that with a couple of cloves, and you want to do it a couple times per day, but it works beautifully if you have a cold coming on or a virus. So we use it for that. But then, of course, we've got this cardiovascular component as well. And so particularly aged black garlic can really lower cholesterol. And then there's a little bit of data for it lowering blood pressure as well. Now, again, you want to make sure you're taking a high enough dose. Usually we do that in a capsule form. You would have to eat a lot of raw garlic in order to get those benefits. So a capsule form is a great option there. But yeah, we find this in a lot of our cardiovascular blends.
Yeah, it's a really nice way to really support cardiovascular health. And garlic is pretty inexpensive for a supplement. So again, like one of these great plant medicines that's not going to break the bank, and it's going to have like wonderful cardiovascular tonic effects.
Yeah.
Yep.
We should also talk about hawthorn. So I know that you use hawthorn a lot in your practice, as do I. I love hawthorn because this is another example of where we can take, an herb and see how it works in the body physiologically, but also the energy behind that herb. So hawthorn, yes, we know that hawthorn is great for palpitations, and really we kind of refer to it as a cardiovascular tonic. So it really does a lot to tonify our heart and our cardiovascular system. But also I love to use this as a heart opening herb. So if patients have palpitations from anxiety or something that they're really worried about, hawthorn is great for that, right? It's kind of a nervine in that sense that it calms us down, but also really tonifying for the heart. Yep. How are you using hawthorn?
Yeah, well, so first of all, I actually take hawthorn personally because I have an arrhythmia. I actually have an extra, basically, pacemaker in my heart. So sometimes that can kick in and I can get like tachycardia, so a rapid heart rate. And instead of jumping to medication because it doesn't go, over 200, it, just mildly elevates, but I can really control that really well with using hawthorn, and I take it regularly. So I take that. It's a beautiful, beautiful cardiovascular tonic. I take it every morning. I use it in tincture form. And I do recommend this for a lot of my patients. There are a lot of different ways to take it and indications for it, but that an arrhythmia, hawthorn can be really nice there. Another thing I'll use it for is for patients that have elevated blood pressure. And so there's some really nice blood pressure lowering effects for hawthorn. Yep. And then also just, especially, there's some, compelling information about the energetics of hawthorn, as you said, and that it's heart tonic, heart protective, but from even, a sadness or grief standpoint, heartbreak, and there is, broken heart syndrome. We do know that that's actually a, cardiac condition. And this particular herb is really nice at sort of like covering that aspect as well in light of a cardiac problem.
Right, because with broken heart syndrome, again, that comes from stress. And so that energy that hawthorn is bringing in to really calm our nervous system, right, innervating our cardiovascular system, it's a great way to use it. So yeah, how does it taste? Tincture form.
In tincture form, just like most tinctures, it's a little bit harsh. But when you're using tincture is very potent. So tincture is like an alcohol base. For people aren't aware what tincture is, it's typically in an alcohol base. There are glycerin tinctures. So when we're using like a liquid form for kids, you can get it where it doesn't have any alcohol in it. But I just like use a teaspoon and put it in a little bit of water, and I just like drink it down, take it. Now there's also hawthorn solid extract that tastes amazing. It's really good. It's so good. So that's, it's basically like a paste. And we do have that in our office as well. And so for some patients, we'll use it in a paste form. And then there's tea as well. So you can really get good quality teas, organic hawthorn. So there's a lot of different ways to get that, into your patient or get circulating.
I tell my patients, look, like this herb, I'm giving it to you in a tincture form. I want you to taste it. It's medicine. It's not supposed to taste great, but there is that added element when we're tasting the herb that we're taking. I really feel like it's more powerful, and it works better when we're tasting it. So I also like tincture forms, but that solid extract is really good.
It is.
We only have a couple minutes left here. I just want to briefly talk about a couple of other these aren't necessarily herbs, but nutraceuticals that we use cardiovascular wise, and that would be plant sterols and plant stanols. And these come from vegetables, right? They come from plants, hence their name. And this is another common element that we'll see in cardiovascular supplement blends because it really competes with dietary cholesterol for absorption. And so these plant sterols and stanols are going to prevent your body from taking in and absorbing dietary cholesterol. So that's how those work. So I just wanted to mention that because those are really common.
Yeah.
Are you seeing that a lot? Do you use those?
Yeah. And some of, as you're aware, we use a really effective combination product that does have red yeast rice and some sterols and berberine in there that is really, I've seen mind-blowing effects with this particular formula where people, their LDL can drop 100 points from like way up in the 200s, just with a pretty relatively small dosage level in a short period of time. So this medicine works, the herbs do have like amazing benefits. Sometimes, depending on what you're treating and the severity of the condition, how long it's been going on, it could take a little bit longer, but, some of these herbs have, benefits as, right away when you take it in your body, within like minutes, you're having benefit from it.
Yep. If we're really tuned into those herbs in our body, we can feel those effects pretty quickly. Yeah, absolutely.
Yeah.
And then we've got tocotrienols, which is a type of vitamin E as well. That's in a lot of our cardiovascular blends too. And that can really help degrade part of the pathway there involved in cholesterol. And that's also very effective for lowering cholesterol as well. So we use that one too.
Yeah, that's a really good one. I love that.
Yeah. All right. Did we do it? Anything
I think we got through it. I mean, we could keep talking all day, but
we could. We have so much to share.
We're lucky because we get to do more episodes. So thanks so much for joining us, and stay tuned for the next episode of The Natural Doctors.
This is Bristol Health Cares. Special thanks to Nutmeg TV. It's a nonprofit organization. An organization that's going through some difficult times right now and needs your support. Many of you out there have cut the cable, as I have cut the cable. And a lot of the funding that took place for nonprofit stations like Nutmeg TV throughout the state of Connecticut, as people transition from cable TV to the other methods of getting their content, the funding has gone down and down and down. And so programs like this, like you're seeing today, and the programs that you watch on Nutmeg TV, may not be there in the future if we don't all rally behind them and help them with our support to the extent that we can. So have a wonderful day, and until the next time, this is Kurt Barwis, President and CEO of Bristol Health, signing off.